Performance-Driven Academy webinar. So we will advance to the next slide. Again, officially, I would like to welcome you to today's webinar. It's a part of the MCTAC Performance-Driven Academy. This is actually the second webinar in a series of 12 that will take place over the 2018 that really have been designed to support the development of performance-driven organizations. And this one really is a focus on collaboration. It is brought to you, as we said, by the MCTAC group, and the MCTAC is made up of the McSilver Institute, CASA, the National Center on Addiction and Substance Abuse, and again, as we said earlier, with CCSI as the upstate New York partner. This is John Lee. I'm the director of the CCSI Center for Collaboration and Community Health, and again, it is my pleasure to welcome you to this event. Next slide, please. Just a couple of reminders, and if you're not sure what that acronym stands for, PDA, that's the Performance-Driven Academy, which you're a part of. We just want to remind everybody that everyone in your work group should be registering for one of the in-person sessions that we've announced. We do believe that participation in the in-person sessions are critical to really not just hearing about the steps to become a performance-driven academy organization, but also to experience and move your organization forward with these processes. If you haven't already done so, please complete that baseline survey. It helps us to get a sense of where you are at the start of the academy. And again, a similar survey will be done at the end so we can see what kind of progress you've made. Again, how's it going? We sent you a survey link with materials and in the chat box. Please take a moment to fill that out, give us some feedback so we know what additional steps we need to take in order to move forward in a way that supports you. Also a reminder that the webinars are recorded, and if somebody on your team is not able to attend one of the webinars, please make sure that they receive the link that you will get through your email so that they can participate and, again, hear the same information that you've heard. Use pda@ccsi.org to email any questions that you have. We promise we'll get back to you as quickly as possible. And as the speaker is talking, sharing information, don't hesitate to put questions or comments in the chat box. From webinar 1, as a reminder, you should have taken the baseline survey, but if you haven't done that yet, there's still time, so go ahead and do that. You should also schedule some time between the webinars to meet with your work group. Again, you should have anywhere from 3 to 5 folks that are part of the leadership team of your organization participating. We really believe that getting the team together is critical for taking this information and making it actionable within your organization. Hopefully you had a chance to complete the performance-driven culture readiness assessment and have had the chance to talk about that result with your work group to see where your opportunities are. Hopefully you've also gotten feedback from others in your agency about the culture of your agency. If you recall, we said, hey, we want you guys as the leadership team to really assess the culture based upon these practices, but also chat with folks just to see how they would define the culture of your organization and whether that really reflects what you would like them to be sharing when someone asks that question. Also, you did receive a reminder email a week ago in the materials for today's webinar this morning, not too long ago. So if you did not receive that information, the PowerPoint for today's webinar, please go ahead and email pda@ccsi.org so we can make sure to get those to you. Next slide, please. Just a reminder that we're on a journey. This is kind of the roadmap of that journey for the first 6 months of the year. In January, we had a conversation about the importance of culture in the organization to support performance-driven work, to make sure that there's that belief system throughout the culture that says, we need to do this, we want to do this, we want to know how we're doing. Today, we're having a conversation about collaboration and how significant that is to really improving your work. In March, we'll talk about human resources. After that, there is the in-person sessions that we're holding in 3 different places across New York State, opportunities for you to work with your team on advanced information that we hope will be helpful in solidifying what these processes and beliefs really mean for your organization. And then part 2, which begins in April, will focus on effective measurement. So that's the journey that we're on through the end of June. Again, so today's webinar is about collaboration and thinking about collaboration as a tool for success within a performance-driven organization. We're really pleased that today Dr. Brandon O'Connor will be our speaker, and I'd just like to share a little bit of information about Dr. O'Connor. But first, let me just give you the visual of a performance-driven organization. This was created by CCSI to help organizations at a glance see all of the elements that need to come together to really believe that your organization is doing the work in a way that will allow you to be not just performance-driven, but to achieve the outcomes that you're really looking for. So again, last week we talked about the culture, which is the dark blue that's behind a series of processes and infrastructure elements that we're going to cover in our webinars. And then what is encircled around culture and processes is this notion that to be successful, we have to have effective internal collaboration, meaning folks need to talk to one another, and we also need to support network development through external collaboration. So these are the areas of focus, and again, today's conversation is about the importance of collaboration. Next slide, please. So today's speaker, Dr. O'Connor, has a doctorate in clinical psychology. Her expertise is in children's mental health. She's done a lot of research. She's published. You know, we value her ability to support our work around statistical analysis, evaluation in real-world behavioral health settings, and certainly as accountability increases, her role in really supporting the ability of agencies to measure their performance in a meaningful way is becoming ever more critical. And at CCSI, Dr. O'Connor is the Associate Director for the Center for Collaboration and Community Health, and again, continues to do a lot of work with behavioral health providers and networks to really make sure that as we better understand what the priorities are for payers, that we're in a good place to deliver. Now what I'd like to do is turn it over to Dr. O'Connor, where she'll review the learning objectives and begin to share some information. Dr. O'Connor.
Thank you, John. Hello, everyone. Today, during the remainder of our webinar, we will be talking about collaboration. We'll reflect a little bit on why collaboration is important to the success of your organization, particularly in the current healthcare system. Review what we know are out there of a couple of fears and challenges of collaboration and how those might play a role in the steps you take to facilitate collaboration, talk about some factors that have been shown by other groups, other states, other networks to really facilitate collaboration. Included in there at the end of the little presentation will be our agency experience, which we're really excited about today. Marty Teller is with us, and we'll introduce him more fully in a few slides. And then we also have some tools that that we've provided for you. They're in the chat box for you that support effective internal and external collaboration. So we'll give you a brief overview of what those are and then some takeaways for how to implement them with your work group in the next couple of weeks. Before we start talking about collaboration, certainly you've all thought about it already. Many of you are probably participating in collaborations in some way, formal or informal. But I just wanted to have you kind of level set and just think about for your own kind of setting yourself up for this presentation. But in an ideal world, who would your collaborators be? What could you achieve if you were working together that maybe you can't achieve alone? And then what might stand in the way of building that effective collaboration today? So identifying those barriers and what you could achieve can really help you develop a work plan for thinking about how you can more effectively pursue collaboration. So first we want to just talk briefly about why collaboration is important for your organization and in the current environment. We are well aware, I think, in behavioral health that successful collaboration with other providers and systems can really lead to those impacts that we can't achieve alone. Some examples are, readmission from a hospital or follow-up from a hospitalization for a mental health or behavioral health reason. Those really, though they're kind of tied to the hospital, they really require the system to perform together, to have those step-down care locations, to have those warm handoffs, to have community-based supports for individuals, and really requires all parts of that system to work together to provide care for that whole person. We know that reducing this sort of fragmentation in care and those service gaps leads to this team approach that leads to the greatest change and the greatest outcome for the individuals. It improves quality of care, it improves patient outcomes on a number of different measures, and really promotes that holistic approach to care. It's looking at the whole individual and all of their needs together, as opposed to just where they're at with their one particular service. Often talked about, obviously, reducing silos. Having a collaborative approach really does start to reduce those silos, and that in turn improves both the continuity of care for the individual and also safety. And we know that also collaborating with other providers in the community across the system can really create that value and that respect among the providers, so they really understand what's available in their community and where the best places are for their patients to get care. These models as a whole, collaborative models that look at this team approach and look at this cross-system sharing, really are more likely to reduce those high-cost pieces like multiple avoidable ED use and repeated inpatient hospitalization that are very expensive in our system, and so we tend to think that models that lead to greater efficiencies and cost savings for the system as a whole generally do rely on collaboration. And it's really about thinking about that little bubble question there, what can we accomplish together? Another piece of why collaboration is critical currently is also that it's really, as I mentioned, it's the foundation of success of a lot of the structures of our healthcare system today, because some of the incentives are tied to either those collaborative efforts directly, such as in the behavioral health care collaboratives, or it's indirectly tied, as I've been describing, to those outcomes that are just difficult for any one piece of the system to achieve by themselves. So again, follow-up from hospitalization for mental health illness, it really requires multiple pieces of the system to come together to provide those community-based services, provide those lower level of care services, the community-based programming, social support, family support, things like that, all of those that are different pieces that usually are under the purview of different providers. And we know as the system is shifting to a payment environment that really is increasingly interested in paying for outcomes, paying for performance, value-based payment, whichever model you're thinking about, it really is incentivizing those systems to start collaborating or to improve collaborations to get those better outcomes. So thinking about the system, the healthcare system and the incentive system, the funding really being tied to collaborative impact, collective impact and collaborative processes, the question that you might be thinking about for your own organization, your agency, would be, what are those priority outcomes described by these incentivizing collaboration? What are they looking for? And then how does my agency contribute to those priority outcomes? We don't need to spend too much time, I think, on why collaboration is important. I think everyone on this call probably has some ideas about why it's important for your organization and could have probably given some of the ideas that we just talked about, but we also want to be clear that there are a number of limitations to collaboration, or a number of fears about collaborating, and these pictures depict a couple of unequal workloads, and of course making a lot of effort and not getting anywhere, and then of course those meetings that just don't end up with anything accomplished. So there are a lot of fears and challenges around collaboration. So I have two slides here of what we think are some of them. If you think there's others that we missed, you have other ideas, feel free to chat them in to all panelists, and I will include them in our conversation here. We're going to keep everybody anonymous because it's just easier on our end as well. So if you have any other ideas, other fears or challenges around collaboration that you'd like to share to the conversation, please feel free to chat them over. We do know, again, some financial incentives, though the system is shifting, there are some that are still in place that really more incentivize keeping things the way they are. So, for example, the fact that there are still a whole host of services that are fee-for-service really doesn't incentivize collaboration specifically in the same way. There's often a lot of motivation or investment from stakeholders in the beginning of an initiative, whether that's because it's tied to funding or tied to a lot of energy or a lot of politics, but maintaining that over the long period of time that's required to establish a successful collaboration can be a challenge. We also know that when folks have tried collaboration in the past and it hasn't been successful, whether that's an external collaborative relationship or even some of that interagency collaboration in-house, if they haven't been successful with that, they're often a little bit more reluctant to try it again. It's just a natural state of people. And then we also know that trust is really critical, especially among collaborators in this environment where in a community perhaps your relationship has not historically been collaborative necessarily. Perhaps you've been competing for the same patients, and that can make a very difficult dynamic to start with. And so the shift in thinking to overcome that is really part of what we're hoping to talk to you about today. Some of the other fears and challenges involved in collaboration are a little bit more practical. So sometimes when 2 or 3 or 4 organizations are coming together and they maybe are across systems, they might not understand each other's jargon or the professional terminology used, which can lead to some slowdowns in collaboration. Not being clear about who has what role, or if there is a role with a particular, that has more power than the others. So in the case of a grant fund, for example, where one person has the grant funds and then becomes sort of the lead agency, if that's not talked about in a collaborative way and established carefully, folks can have just a misunderstanding of what their role might be in that collaboration. Certainly there are concerns about confidentiality when we're talking about behavioral health data, and particularly substance use data, and so having those on the table and discussed and plans for that can be critical. And then often folks, to that point of doing a lot of work and not seeing a lot of benefit, if you're going to come together for that improved impact that you really want to see, not having clearly articulated measurable outcomes or the impact of the work described that really drives the work and drives the motivation behind everyone can really stall a collaboration. Fear of change, just not wanting to change the way we're doing things to do them in a different way because things are working right now and we're sort of struggling as it is, can also really be a barrier to collaboration. And so overcoming a lot of those challenges is the first challenge of a successful collaboration. So we acknowledged that there are a lot of challenges, there are a lot of concerns around collaborating, but we're going to propose, especially based on the information about why it's so important in our current healthcare environment and for outcomes of the people we serve, that we're going to go ahead and get started anyway with the collaboration. So what we have next is a series of slides that really talk about what specific things are helpful in collaborative practice. So it's based on experiences that we have, knowledge and expertise, as well as some existing literature, other models from other states and other areas. So these are things that are not just kind of best practice, not just us thinking about what might be helpful, but it's actually demonstrated from other communities as well. So one aspect that might be helpful in supporting effective collaboration is really the attitude and approach to it. And this is, again, a little bit more amorphous, a little bit harder to describe, but it's developing that trust and respect among collaborators. And the best sort of practical method we can think of to describe how to do that is to really start with assuming everyone has the best intentions in coming to the collaboration. As I mentioned, change is difficult, and we all know that, especially if we've been in the behavioral health field. We're well aware of how difficult change can be for everyone. That's sort of our bread and butter. Acknowledging that it is difficult, acknowledging that it takes time and there's a process, and just saying, okay, we're a collaborative is not going to change anyone's behavior right at the outset. So taking time to clarify who is in what role, how are those going to work together, what's the process going to look like, and really making an effort to practice demonstrating that mutual respect for the knowledge and the skills that other folks are bringing to the table. Collaboratives also sometimes get stuck when there's not regular contact maintained. So there's a couple good meetings and then things sort of fall away and then nothing happens and then folks get frustrated because the collaboration wasn't as fruitful as they wanted it to be. So it's important to not only maintain that regular contact but also follow through with whatever was committed to by each party in each role. It seems sort of like a very kind of obvious example perhaps, but also approaching a collaboration with a friendly attitude where you're interested and open to suggestions can be just reminding yourself that that's how you want to approach a collaboration can change the tenor of the conversation. Certainly where practical, including members from all of the relevant systems that will be touched within the collaboration is really critical, and also consumers or family advocates, depending on whether you're working with adults or young people. Having those individuals who are touched by all of the systems and who know firsthand what it's like to navigate all those systems and how and why a collaboration can be really, really beneficial, their voice can really help you guide your collaboration efforts. Another factor that we know is very predictive of a successful collaboration is history of successful collaboration. Again, from the behavioral health provider's perspective, we know that. History is something is a pretty good predictor of it again. But there's an easy way to start this. So if you think, well, we don't have a history, so it's going to be harder for us, there are some practical suggestions in here. So bringing teams together for whatever might work out, whether that's a cross-training, whether there's strategic planning meetings about your community, thinking sessions about potential funding coming down from the state or the feds that might fill this gap that you guys can identify. Having everybody in the same room, hearing the same thing, giving some time to think and process can often spark ideas about what do we need to do differently for our system or what's the opportunity that we have to do something better for the people we serve. And just in general, shared training can often be a really fruitful avenue to help potential collaborators and then established collaborators really understand and appreciate what each other brings to the table and what the pieces are that need to come together. Collaboration is often successful most when it has particular leaders or champions involved in it. So these are the folks who often in the early efforts of collaboration, they have the vision or the initiative, they're advocating for the collaboration or advocating for to fill this gap, whatever this need might be. But really it's leadership at a lot of different levels. So certainly there needs to be some leadership from folks at the top, those with the authority that can actually say this is what we're doing, create the policies and programs and provide the support for this collaboration. But then it's also really critical to have leaders who are sort of in the middle. So that's your maybe middle managers, supervisors, people like that who can facilitate some of those meetings and can have those collaborative conversations. Regardless of where they are in the organization, though, it's also really important to think about who are your natural leaders. So these are sometimes called opinion leaders or respected others, but these are the folks who a lot of different people highly regard them. They're respected. They're seen as a credible source, and they have a lot of integrity, so they aren't, an outsider coming in and saying, this is how you should change and do things, but it's someone who knows what they're talking about, who's been around. They can often mediate between systems, if they have relationships on both sides or in a couple different areas within the community. So those are the folks that you want to try to identify also. So who are those natural leaders? Who do people look up to? Who do people follow? And who has relationships on that other side of whatever you're trying to collaborate with that can help make it more about people instead of systems. Making sure that the collaboration is matched to the mission and those shared values between collaborators is also a really critical element. And depending on where the impetus for the collaboration comes, sometimes this isn't as much in the forefront as you might think it should be. But it really focuses on identifying that common purpose for this collaboration. What's our shared understanding of, again, the measurable impact or outcome of the work? What are we doing and why are we doing it? It often does require thinking about the mission of your organization, the mission of this collaboration, the willingness to really acknowledge something that we're doing isn't working the way that we want it to. And so let's refocus that energy on what is the opportunity that's been presented, what can we accomplish when we collaborate, when we work together, and how can we move towards that end. This often involves having an organization step outside of their comfort zone. So you know what you do and how you do it, and that's comfortable. And you might see a little gain here and a little gain there. But this really involves stepping outside of that and saying, okay, let's shift things up. Let's try something different. Our 20% rate that we've been getting for the last couple of years isn't enough. We want to see that go up to 60. So with whatever that might be. So that is really an important part of what's our mission. What are we trying to do? And oftentimes when we're talking about collaboration or any of these new initiatives, one of the barriers that folks will describe is buy-in from staff, buy-in from the teams that have to participate, and resistance to doing this. And really what this suggestion, what the research here is suggesting is really that if you are aligning this collaborative effort with the mission, that you should be overcoming most of that resistance, and you should be accomplishing buy-in, because if you have folks who are saying, I don't want to do that, I don't think it's great, but then you're presenting them with, well, it helps our mission, it helps the people we serve in X, Y, Z way, of course they'll, have a light bulb moment. That's the thinking, anyway. And again, here, just a reminder that the families, the patient advocates, those consumers, those are the folks who know what it is that your mission is accomplishing and where those gaps might exist. So really including them in the conversation and identifying how does this collaboration move forward our mission is, again, another critical step. It seems like it goes without saying, but of course, a genuine commitment to collaboration facilitates collaboration and makes it more likely to succeed. But what I found interesting here in coming up with these suggestions here is the literature around it doesn't actually matter if the impetus for the commitment was outside of your system. So certainly it's great when you have two champions in two different systems or two different organizations who say, hey, let's collaborate. That's really, really great, kind of ground up. But even in situations where the impetus is something else, perhaps a funding line or perhaps a redesign of the healthcare system, whatever might be providing that impetus, it doesn't matter. As long as there's early commitment from stakeholders, then it's still more likely to be successful. So even in those situations where collaboration has sort of been described as something that needs to happen, that's fine. As long as the stakeholders are committing to it early on and kind of strongly, it can still be successful. This commitment also acknowledges, though, that this is an ongoing process. So committing, 2 or 3 folks getting in a room and saying our systems need to come together and collaborate is all well and good until one of those key stakeholders leaves, takes a different job, moves out of state, wins the lottery, whatever they do. That is when it's really important to, again, reinvigorate and recommit to that collaboration. And something that you can do in these situations is really look to those champions for help with kind of making the pitch to the new staff member, the new stakeholder, about why this is critical to the organization and how it's been helpful or how it can be helpful in the future. So those were a lot of those, again, those factors or facilitators of effective collaboration. And now is a couple of slides really talking about what are some of those specific steps. So you could take these couple of slides and go away with them and say, okay, here's how we're going to do what these best practices suggest. So one would be to start small. So if you, and this is again assuming that you don't have a collaboration in this area that you are thinking of developing one, but it's also just best practices for thinking about your existing collaborations and maybe if they've gotten stalled or they've plateaued, how you might, again, kind of reinvigorate them and give them additional energy. So thinking about collaborative efforts, when you're in those conversations, those cross-training meetings, those strategic planning meetings with members of different service sectors or different systems, certainly the ideas will fly because you put a lot of smart people in a room who are really invested in the outcomes for the program or for the folks that they serve, and everyone has great ideas. And it's easy to get sort of overwhelmed with, well, we can't make that change or we can't change the law about this or that. So really instead kind of step back and think about something small, maybe a specific program or a model, some individual, maybe warm handoff process that fills a gap or might address an opportunity to improve an outcome for a person. And start there and see what happens with that collaborative. See how you can gain some momentum there. Look for potential opportunities as you're starting to facilitate some of those collaborations or trying to strengthen them up. Look for opportunities to what's called transfer technology. That can be your ideas, information you have, even technical assistance from some of the collaborators in your network. That involves maybe going and visiting, looking at what they do, talking about what you do and how they fit together, what the experience is for individuals on both sides. Maybe sharing some policy documents if one of the collaborators is further ahead of another in terms of how to walk this through for documentation reasons or policy procedure avenues. Actually kind of talking about program models, what you might suggest to revise, what might need a little bit of adjustment to be more successful, and then even looking at data together and saying, here's what we found, here's our dashboard, let's talk about it, let's talk about how that lines up with the data that you have and what might be missing there, what other information we would need to know whether this was the right move. But any of those sort of steps of just sitting down with someone or visiting and talking about, here's something that I know and I want to share that with you, can really start a collaboration or reinvigorate a collaboration in the right direction. And then again, from a behavioral health perspective, you can hear psychologists probably all over this presentation because it's about how people learn and change. But we know that success leads to success. So really starting with something that is easy is the ideal for collaboration. So starting with a milestone that might be pretty reachable can help lead people to realize that the investment and the time to participate in this collaboration is worthwhile and successful. Early success helps with motivation to continue collaborating, and also provides an opportunity for you to seek additional funding to expand your collaborative activities. So if you have kind of a small area or maybe a specific program that you want to start trying to collaborate on, and then you are successful with it, then you have some data that can back up a funding application for additional resources to expand that collaboration broader. The next step in thinking about the practical pieces of a collaboration, and again, it can be an existing one that you want to reinvigorate or re-energize, or kind of a new territory, is to think through how you're going to think it through. So answer some of these questions, and these can also be within your work group. You can think about whether existing collaborations you have participated in, whether you address these things, whether you need to bring these back to that group or to those committees and see if that's helpful. And then also if you're thinking about branching out into new collaboratives, who's going to think through these questions, who's going to answer some of these questions. So it's questions like, how are decisions going to be made? Once you have a collaborative effort, there's no longer sort of a head of the entity sometimes, and so someone has to have the ultimate decision-making authority. If you have committees, so I know some of the BHCCs and some of those other networks, bigger networks, they have committees for various little work initiatives, so everyone has a role in something that they feel strongly about. But do the members who are going to those committees, who are having those conversations, making those planning steps, do they have the authority to speak for their agency, their department, or whoever they're representing? And if they don't, then do they have really quick access to the person who does, so that steps aren't being held up because the right people aren't at the table? Also want to think about how you're going to identify and address issues that come up. Just know that issues are going to come up. You're going to have differences of opinions. People have different perspectives on the right approach. They might agree or disagree at the meeting and then change, the actions that they take. They might do things, they might take actions that weren't discussed around the collaborative. And so knowing that that's going to happen when you have people with different perspectives coming from different areas, how are you going to work through those? How are you going to do it in a very open, transparent, neutral manner, and then also very timely so things don't kind of snowball out of control? Thinking about communication around some of these pieces is really critical. We all get inundated with emails. I know we send you several emails that are sitting there giving you great information, but you only have just so much time in the day. So what communication will be meaningful? How timely does it need to be to make the decisions it needs to be made? Should it be, what consistency should it be? So should it be every week, every 2 weeks, every month, every quarter? What does this collaboration need to keep things moving and create motivation to continue doing it? You also want to think through, what are we measuring that will determine the impact of this work? I think the little man on the hamster wheel is a really good thing to keep in mind here. If you're not measuring what's working or how it's working around your collaborative, there could be a lot of feelings of spending a lot of energy and not really seeing the output for your work. So how are you going to know that this collaboration is successful? What are you going to see? What will indicate whether you need to adjust course or whether things are moving along as expected? And how often are you going to be looking at these things? If you have a collaborative and you have a great outcome, but you only look at it once a year, that's probably not going to tell you enough information about whether you're being successful. So to help you think about some of these things, the tool that we've created, the two tools, I should say, that we've put together for you today to support collaboration are linked to you in the chat box. But they are, one is a sample agenda, a series of sample agenda items that sort of support productive collaborative meetings. So there are some facilitation or process elements, such as doing a quick check-in when people get in the room, maybe setting up the guidelines for how we're going to communicate in this space as a collaborative exercise, things like that, as well as some content examples. So some of those conversations you're going to want to have early on with your new collaborative is, what do we hope to accomplish? What is our goal? What are some challenges that we anticipate? Having some of those pieces in your agenda can really help give structure to the conversation and really identify this as something separate and new, and we want to re-energize our efforts here. So take a look at that. This is, I think, a one-page agenda. Probably would be a lot for one meeting. Again, it was meant to be a bunch of sample items that you can kind of pick and choose what works for your meeting, for your content. We also have pulled out the Gradients of Agreement scale and a little brief write-up about how to use it and how it might work for you. And what I like about the Gradients of Agreement model, and there are several different types of models, and this one's referenced there, which one we're using, is it really shows that everyone doesn't have to be a cheerleader for something for it to move forward. So on this scale of 1 to 8, really only 7 and 8 are the two pieces of the gradient that would stall something. So you can be anywhere from 1 to 6 and still move the group forward on this decision. And I think that that's a good visual sometimes for some groups around coming up with what we're going to do as a group, rather than everyone has to be in wholehearted, enthusiastic endorsement of the activity. Some of these activities that we're talking about and these tools for supporting collaboration, and again, of course, the stuff that we talked about in the webinar 1 around culture and the things we'll be talking about in webinar 3 on human resources, we are going to be, as John mentioned earlier, we're going to be talking in more detail about these things, and not just talking about them, but giving you more tools, more practice, more time to work with your work group around these things and how to integrate them within your own agencies at the in-person events. So there's only just so much we can do in a 1-hour webinar, of course, but the in-person events will really take a deeper dive into how to use some of these tools and how to integrate them within the culture of your organization and within these collaborations that you're developing, so that you can feel like you're changing how you're approaching some of these things, or adding a tool here or there to your toolbox, rather than just having a webinar that you are not sure how to integrate. So come to our in-person events. We'll talk more about how to do some of these things in a meaningful way. With that, I would like to introduce Marty Teller. We are very happy to have him joining us today to give us the agency experience around collaboration. He is the Executive Director of FLACRA. I will let him describe FLACRA and their efforts around collaboration. It's very exciting work, and I will open the floor to him and ask questions as they come up. If you have questions about anything that we have talked about, or as Marty is talking, please feel free to chat them into all panelists so that we can all see them, and we will address them. There's a few slides after he's done about what to do next, so don't just jet after he gives us his input. Marty, you are unmuted from our end if you are ready to unmute on your end.
All set, and thank you for that introduction. And I'll say I have the pleasure of working with John Lee on a very regular basis, and more recently Rhiannon, and way to go, folks. Honestly, while I have staff participating in the Performance-Driven Academy, this is my first exposure, so that was great, and I learned a lot, and I hope that's so for everybody else. What I have the pleasure of being able to say is that FLACRA, Finger Lakes Area Counseling Recovery Agency, we are a regional covering primarily Wayne, Ontario, Seneca, Yates, and Schuyler counties, rural, residential, and outpatient substance abuse provider. We provide a number of other services, including health home care management, housing, jail services, and all kinds of other contract programs. If we go to the next slide, we are, in this context, very focused on the partnerships we've created in the Finger Lakes and Southern Tier region. By coincidence to this theme of this particular webinar, FLACRA's tagline is "Together we will." That shows up on all things that we do. You know what an agency's tagline means. You know how meaningful it is. It's at times more meaningful than the name of the agency. so I think coincidental to the theme here of collaboration is really our tagline being, together we will. So in the next group of slides, and we'll hit this, we'll probably race through these slides more to just describe the various collaborations that FLAC was involved in and how all the leadership roles in. So Recovery Net's an entity that formed about 10 years ago, and that was honestly in response to the fact that hospitals were looking to be very different and than community-based organizations. And we were really concerned as community-based substance use providers that we may find ourselves in a very, very secondary place in substance abuse care with what hospitals were up to. So we formed this community-based organization of substance use providers, and we agreed, and so much consistent with all the great things that Brianna showed us, what's our purpose? And our purpose, it comes in our, in the common area of us being substance use providers, and we all recognized, and this was a time when electronic health records, as you know, were just coming to be in our substance use agencies, and we were determined to develop a common electronic health record. We've done that. We've gotten lots of other grants through DSRIP more recently, and are the first open access clinic. It's a collaborative clinic in Rochester, in all of New York State. So, that little group really has done a good deal. We can go to the next slide. And these collaborations very much overlap, and honestly, both have the pleasure of some of the work of John Lee and CCSI and Brianna, and we are all hearing through a lot of the MCTAC stuff about IPA development, and we in the Finger Lakes had been in a collaborative, a very informal collaborative, where the FQHCs, the Federally Qualified Health Centers, and me alone as a behavioral health provider were working, in an informal way, and we came to a place where my agency started co-locating staff in a particular FQHC. And that, as the FQHCs were coming together to form an IPA, made it very clear that maybe we need behavioral health providers in this IPA to have collective impact. I think when Brianna used that, I think that's significant. We know, that that behavioral health clients surely make up significant proportion of emergency room visits and hospitalizations. And primary care entities, FQHCs, make up all things primary care and all things medical service. So it made sense that from a collective impact perspective, we could form an IPA that would bring together FQHCs and behavioral health partners. And as Brianna spoke, trust, confidence, fear of change. I can highlight any number of things that were on those previous slides, but as this group had been together for 7 or 8 years informally, me being the only behavioral health provider, we built up a tremendous sense of trust. At the same time, as was shown in previous slides, jargon and language, that was the greatest irony for myself as a behavioral health provider and for all the FQHCs. They had no idea what I was ever talking about with all the acronyms I was trying to use, and over time, the culture shift in all those regards has been tremendous, including cross-training and all kinds of other things. And now we are headed in a very serious direction and well-positioned as we are entertaining, as previous slides showed, in a managed care environment. We believe we are well-positioned for a value-based proposition to deliver to respective managed care organizations. They have expressed huge interest in us. We are, are one by one bringing them on into our meetings and entertaining value-based payment arrangements with them. And similarly, you are aware of behavioral health care collaboratives, and FLACRA made application to be a lead when the request for applications came about, and FLACRA was awarded a lead role in what has formed as the Finger Lakes and Southern Tier BHCC. In relation to challenges, and the BHCC, much like the IPA, is geared toward bringing folks together, advancing their positioning in a value-based payment environment, and these two entities will need to figure out how they will collaborate, and we've been guided in a manner that, and I think a key point about challenges in collaborations is you're all part of multiple collaborations. We all need to figure out how these multiple collaborations can collaborate. And we are figuring that out right now, and that's coming in some magnificent forms in relation to seeking similar data analytics sources, seeking similar consultant services, and those are huge items, and we've been advised that these can go on parallel paths until, while collaborating, and may someday come to integrate. So I think identifying where the multiplicity of entities that you're involved in can collaborate, and then where they ultimately go in a more formal way, very important things in that we do see ourselves involved in a multiplicity of collaboratives. We could go on to the next two slides, but I'll, hit them, and let's do so, but I'll hit them quickly and really want to invite especially Rhiannon to query me some more. But for the last 30+ years, we've had this Region 2 Consortium of Alcohol and Substance Abuse Services, which is just what it says it is, about 50+ providers throughout a 9-county region, substance abuse. And this is, in fact, what Recovery Net, earlier mentioned, grew out of as a subgroup, still in collaboration with Region 2. And DISRP, you sure know all about DISRP, and our Finger Lakes Performing Provider System happens to be what, this PPS is called. And we are all, as you all are, involved in multiple collaborations within those, and specifically, well, I don't even need to hit these items. We, as I think all PPSs do, have a behavioral health work group, CBO advisory, lots of pilots and innovations going on. But I'd really be happy to take the remaining moments to some querying on Rhiannon's part and further discussion. And Rhiannon, you want to
Certainly. We do have a couple questions from folks, but I thank you for describing all the various ways that FLACRA is involved in collaborations, because I think one of the points that you made is really important, that a lot of the collaboratives have to collaborate, and then that adds a whole layer, as you described, of how to navigate those relationships. Someone was curious, what services do you share with other collaborating networks?
By example, in the Recovery Net and the Open Access Clinic, we literally are, the multiplicity of the 7 partners are literally plugged into serving the Rochester and surrounding community. So we're plugging in our staff. Shared services include the electronic health record in the Recovery Net Collaborative. We share data in the Recovery Net Collaborative. We're sharing data right now in small ways in the IPA. So what else? Now, we've also been having conversations about, as you may be implying, back office sharing, IT. So let me just say, in the Recovery Net Collaborative, we have one central IT resource. That saves significantly in the, for the individual providers. St. Joseph's Villa serves because they have the biggest and best IT support. So we all throw in a certain fee depending upon the level of IT support we want. So IT support is huge in shared services.
Certainly. Thank you. Marty, I'm going to advance while I ask you my next question to your contact information, if that's okay, so folks have it in front of them.
Yeah, sure.
So earlier someone had sent in a comment about some of the challenges or fears about collaborating, really thinking about those collaboratives that sometimes don't necessarily work. So if a collaboration were to fail, there might be kind of that negative relationship, negative environment that would then kind of be the consequence. And so sometimes that can be one of the fears in approaching a collaboration. And since you've been part of so many, can you talk about how you maybe approach that or think about that, or how you've navigated some of those potential?
Well, I think as you described in some of the slides, knowing what you're all about is important, but also recognizing, and we are going in next month to a strategic planning session for the Recovery Net Collaborative I spoke about. Because what collaboratives might need to recognize in direct relation to what you've said is, where there, might there come a time when, with all else that's going on, and I showed you a couple other things that's going on that kind of, you might say, relate to some of those other collaboratives you saw, might it be time for Recovery Net to consolidate with some of those others? And that, that's huge, because we've been together for, 10 years, and but it's getting obvious that we've got a lot to bring to those other collaboratives with the shared record. So I think looking at, whether you need to, don't be afraid to jump into collaboratives in response, just in relation to fear, and figure out, though, once you're in, don't be afraid to be assertive and aggressive in terms of a transformation within your collaborative or in alignment with another collaborative. And that screams in some of these things that I've spoken about.
Well, thank you, Marty. This has been really, really great to hear from your perspective and all the different types of collaboratives and how they've evolved over time, some of the more established and some of the newer ones. So I think it's been really, really valuable. Folks can see your contact information. If they have any kind of additional follow-up questions, you can certainly send them through us through the chat box, and we'll get them over to Marty and get his words of wisdom. But I do want to thank you, Marty, for your time and for sharing that with us.
No, thank you.
So just to wrap up before we finish here in the last couple of moments is where we like to end some of our PDA webinars is really around, okay, what do I do with this information? And so we have a handful of takeaways for you this time. Hopefully you were able to look into the chat box and fill out our survey about last webinar about how helpful you found webinar 1 and the takeaways and the tools there. We really are going to be revising as we go. So if you have feedback about how things are going, what we're presenting, how deep we're going into things, if you have other thoughts, we'll be looking at them between every webinar. So please provide that information for us. It's, I think, 3 questions, so it's really quick. So takeaways from webinar 2. If you haven't already, I know a lot of people joined us for the first time today. Catch up on webinar 1, the content, and even if you were on webinar 1 and didn't yet have a chance to do some of those takeaways, the baseline survey again, we really suggest that you try to catch up a little bit, because that's the readiness assessment and really helps you build the plan moving forward. We would, again, suggest that one concrete thing that you do is set up some regularly scheduled work group meetings between webinars to really think through this stuff, follow up on the takeaways, and keep the ball rolling in terms of progress for your organization. In the sample agenda and one of the tools that you have there, you might think about selecting a few items or processes that you want to try integrating within a couple of concrete meetings between now and webinar 3. I didn't want to give you a set number, but you should come up with a set number, and say, at our monthly staff meeting, I'm going to try these 2 things, and at some other meeting, I'm going to try this thing, and see how you like them. When you come back to your work group to talk about it, see if you notice any differences in how those internal teams are collaborating using these methods or using kind of a reinvigorated agenda. Within your work group, also start to think about who are your key collaborators, or who will they be? Can you answer some of these questions around who are your MCO contacts? Which BHCCs are we part of, and what's our contribution there? What's our expectation? What other collaborative arrangements are we a part of? Who do we want to collaborate with, and what kind of outcomes would that lead to for our patients that would be beneficial? So think through some of those things with your work group, have a discussion about that. Last couple points of business are just preparing for our next events. We did have a comment come in around one of the challenges around collaboration is that you're also not just sometimes in competition for the same patients, but sometimes in competition for the same staff. We certainly know that is something in our neck of the woods that we know occurs. And so the Human Resources webinar coming up on February 27th will hopefully address at least that as a limitation. Excuse me. Please also mark your calendars for our measurement webinars as well as the in-person events. If you have any questions, please use the chat box or email us, and I apologize. Have a lovely afternoon.